A lot of people gain weight. A lot of people are told to exercise on this disease. I'm going to tell you that you shouldn't be exercising, and I'm going to give you the reason, and I'm going to explain that to you. There is a time for you to exercise. And now let me just tell you this also. I'm not saying medication and the standard of care is wrong. There's a time and place for it. If your blood glucose is 400 or 500, yes, you need that kind of medication to bring it down. But it's so overused and abused. I have people that come into this office that I had a lady that came in with hypothyroid. She wanted to lose weight. They wanted to give her insulin. They wanted to just prescribe her metformin to lose her weight. You know, it's like taking a sleeping pill, but you don't have a sleeping problem. You know, it's just easy. It's very abused. Medication is very abused. It's very easy for a doctor to write you a script, and you get a good blood glucose. Okay, so after you were diagnosed, the doctor said, your blood sugar's high, take this medication. Okay, maybe you're a little bit overweight. You need to lose weight, he tells you. You must know how to eat good. You must not know how to eat good, so go find a nutritionist or eat a low-carb diet. And, oh yeah, exercise. I want you to exercise too. This is what most of the population is told. Is it really working? It's not working. People are still gaining weight. And I'm going to teach you today why you're gaining weight on this disease and why exercising isn't the best thing. There's a time for it. When your body's functioning correctly, yes, it's time to exercise. But through my program, you will lose weight without exercise. Are your complaints falling on deaf ears? You feeling worse? Still gaining weight? This particular slide on my last talk, it hit a lot of people because when they came in to see me, I asked, you know, what was it at my talk that hit you? And this one, a few people said, you know, you talked about that I'm complaining and nobody's listening. So you're still gaining weight. You have headaches. You can't sleep. I have no energy. And your joints hurt, etc., etc., etc. You guys are in a ticking time bomb, like my father. My father thought he was going to live forever. And then one day it was done. Danger signs going off. Insulin gives you poor circulation. You start getting numbness, neuropathy in your limbs. There's signs. You start to have vision problems, blindness. You're facing amputations. Guy and I have an aunt that she's very sick with diabetes, very, very sick with diabetes. Heart disease, stroke, all this is the complications from type 2 diabetes. So if you think it can't happen to you, think again. Okay, the U.S. consumes 50% of the world's medication. Okay, USA the world. That's because big pharma, pharmacies, pharmaceutical industry is so big, and even though the U.S. 50% of the medication is bought by the U.S., and the USA is only 5% of the population. So this is big industry here. It's big money. This medications that you're given to every day, they're going to colleges, these pharmaceuticals, and they're just teaching them how to give medicine, It's not always the answer. There's a natural approach that your body is not going to be harmed by, that we can help a lot of diseases. Not all of them, but this particular one, yes. There's a natural way to conquer this, but we have to find the cause. Okay, so here, let's look at this. Your meds are treating the tip of the iceberg. You're taking metformin maybe, Actos, insulin, glyburide, glipizide, and they all are medications to treat your blood sugar problems, which sounds right. Well, I have a blood sugar problem. You don't have a blood sugar problem. You have a problem that results in a blood sugar problem. We have to find out what that problem is, and that's beneath this. Okay, is it an infection in your body? Is it something that's inflamed? Is it your gut? Is it your adrenal glands? Everybody says pancreas, right? Yes, the pancreas is involved. Yeah, that's what we're taught, that's what we know, but it's not only the pancreas. The adrenal glands, the thyroid gland. A lot of people with type 2 diabetes have hypothyroid. And that goes into another kind of disease, which we call autoimmune disease, when your body starts attacking itself. So how do you get better when you have all this going on? So we have to start peeling the layers off. And you have to start finding out what is causing it. If we find out what's causing it and we target it, we have a great chance of reversing this or reducing your medication in a very, very short period of time. Okay, is it your liver? Is it the immune system? If your sugar is high and your body's not functioning right, you don't heal. You need it. You need your sugar to turn into energy. That's what it does. Us as human beings use oxygen and energy. And if you're not turning that glucose, or that sugar, into energy, or your body's not consuming food and turning it into energy, you have a problem. And now I'm going to explain everything to you. So all your medications lead to a lot of organ problems, severe dips in blood sugar, a lot of acid buildup in the liver. A lot of these patients that come to me have fatty livers. Their livers are actually dying because of the medications they're taking. Your bones get weak and you gain weight. And what the medications really do, what I like to say, is bully the body to get a good blood sugar reading. So you take the medications and your A1C goes down a little bit and your doctor says you're fine. You're good. I even have patients that tell me, I'm fine. I take my metformin, I'm fine. Because you feel fine. But diabetes is a slow, progressive killer. It takes years for the symptoms to come out. And they keep giving you, your symptoms go up a little bit, they give you a little more medication to keep it down, keep it quiet. But by then, your liver's already fatty. By then, your immune system is shot. By then, your thyroid is being deteriorated from the autoimmune disease. So are you getting my picture? Like, this is a long process that damages your body. I'm not going to treat your symptoms. I'm going to treat your cause. Standard of care, they give you a blood test, which is limited. I also give you tests. This is all on testing because we need to rate and see what's getting better, what's not getting better. So, but I'll give you an expanded blood test. I don't just look at your A1C, I look at everything. Okay? Standard of care, we talked about the pharmacies are in every medical office, giving them samples, pushing the drugs. A lot of doctors are dictated by what is covered through insurance. Yeah? You're not covered for it, I can't send it to you, even though they know it helps you. Okay? I don't look at that. That's, your insurance is between you and the insurance company. I look at you as an individual, and I'm going to tell you everything I think and know that's going to help you as an individual. The rest is up to you. But if I dictate with your health by what the insurance company says, I'm cheating everybody. And I couldn't live with myself. We talked about it bullies the body to get good results. The meds complicate other symptoms. And we're putting you at risk for other problems by treating your disease this way. They treat the symptom, not the cause. And they give you the standard American diet, which is a regular diet. We're going to give you a very specific diet. We teach people how to buy their foods. We teach people, we give them recipes, we give them grocery lists. We help you in every way you can on this program. Now, I will say, yes, diet plays a big part in this disease. Diet, even the medication that you take, if you're not on a diet, the medication doesn't work correctly. If you don't do a diet on my program, it's not going to work correctly. So it's a big part. A lot of big responsibility lays on you. Now, I don't accept everybody. I accept people if it's a fit. If this doesn't fit you and I don't think it's going to be good for you, I'm not going to accept you into care. I'm not going to waste your time. I'm not going to waste my time. But if it is your fit and you seem a responsible person and you want, your health has to be number one priority. Number one. That's one of my criteria. Okay, so we're gonna get into a little bit of, and I'm gonna explain this to you, and we're gonna get to the meat of this right now, okay? You have your pancreas, this is normal functioning, okay? Your pancreas produces insulin, glucose is in the body, okay? When glucose is in the body, insulin is produced. Together they bind, they go to a cell, the cell allows them in, and once it gets in there, the glucose turns to ATP, which is energy. So this is normal. You eat something, it breaks down in that fashion, and you have energy. That's normal. You have no problems. Everybody here who is type 2 diabetics, this isn't what's happening. It's not happening that way. It's happening this way. Okay? You eat food, okay? You take a medicine. Glucose comes in the body, it's broken down by food. The pancreas secretes insulin. It binds with the glucose and goes to the cell. And here, this little circle is the receptor cell. It's like, think of it as a door that opens or a baseball door, okay? That receptor cell is inflamed. And that receptor cell will not accept the glucose and the insulin. It's all inflamed there, so this receptor cell is not working. So what happens? The glucose doesn't get in. And the insulin and the glucose start floating around. The insulin is a fat-storing hormone. So what do you think happens if you have a lot of fat-storing hormone? You gain weight, right? You gain weight, you get fat. Now when you exercise, you're breaking down, you're eating, you're hungry, you exercise, you're producing more insulin. And if this function is not working, that insulin is just stored in your body. You're actually gaining weight, exercising. If you're type 2 and this is still where you're at in functioning with energy, you're gaining weight. So this is where the phenomenon comes that if you're exercising on type 2, it's not always going to work that way. You're going to actually gain weight. Until this is healed, then. Now what happens when you go on the program and we fix this, you start losing weight automatically. You lose weight in days, weeks. You come in, you're like, I lost 10 pounds. I lost, over several weeks. So that alone, your body's functioning correctly. That tells me your body's functioning correctly. Okay, so our main thing, and I wanted to draw this for you, but I explained it pretty good because when I draw, I really explain it well. But I think I explained it. Now, does anybody know what this is besides the tax? I put them in there.